Thank you for joining us tonight for Pelvic Floor 101. Our presenter this evening is Kathy Merchant. She is the founder of Lotus Physical Therapy and Wellness. She's a licensed therapist with a doctorate in physical therapy and has over 15 years of experience in that field. She's trained and certified in all sorts of aspects of physical therapy, but specializes in advanced women's health, and over the last few years has exclusively focused on treating patients with pelvic health issues. Throughout her career, she's observed a significant lack of awareness in the general public, as well as the medical profession, regarding the role of physical therapy in treating pelvic health issues. Kathy is determined to raise awareness in the community by communicating the benefits of physical therapy over other invasive treatment options, and that's why she's with us here tonight. And so we thank you, Kathy, for offering your services to us. City management has asked me to include a disclaimer that Kathy's opinions and statements are her own and do not represent the views or opinions of the City of Keller or the Keller Public Library or the staff. This presentation is intended to be informational in nature only and is not meant to be used in place of or against medical advice. So with that, I'm going to turn it over to the expert and let Kathy take it from here.
Thank you so much, Anne, for introducing me, giving me the opportunity to kind of speak and present. I really thank you, Keller Library, for this opportunity. So thank you very much. Let's get started about understanding on pelvic floor. So I'm going to start with pelvic floor history. So when I'm talking about pelvic floor history, pelvic floor physical therapy is not very old. In 1980, there was a chapter was initiated in American Physical Therapy Association, and that was only in relation to women who are in the childbearing age. So it was very limited. Gradually, over the time, the scope expanded, and then it was kind of expanded to women and kind of for all the ages. So from childhood came much later, but women with pregnancy, postpartum, menopause, and throughout. Understanding about pelvic floor anatomy and its function, it made it more progression for pelvic health in men, as men also has pelvic floor. And following that, it also made it more kind of a progression towards a pediatric pelvic health, where kids who are having bedwetting issues or kind of incontinence during the daytime or having a severe constipation, they can also be kind of addressed in the pediatric pelvic health. So in that last 40 years, I would say the kind of a 10 to 15 years were a tremendous growth in the pelvic floor physical therapy. To understand it, what is pelvic health? I really like this definition, which talks about it is a best possible functioning and management of the bladder, bowel, and the reproductive organs. So it is not just merely the absence of disease or the absence of the muscle weakness. It is also possible that your muscles are not functioning correct in a coordinated manner. And it also includes the piece of kind of a mental health. So a mental health, the psychological factor is also equally important in a good, healthy pelvic region. So that is the reason I really like this definition, incorporating all the other areas and not just merely talking about weakness or the disease. As we talked about pelvic health, let's look at what is pelvic floor. So when we think about it, the pelvic floor is like a hammock. It's a structure that is passing between the two poles. And the two poles in this situation over here, you can see the back side is the tailbone. And in the front, there is a pubic bone. So the hammock is going from the front pubic bone to the back of the tailbone. and it's creating a hollow structure. So if you want to see it in the pelvis, this is the female pelvis that is I have in my hand. Here is the front part, the front bone, pubic bone, and on the back, I have the tailbone that is coming right here, right there, okay? So, and all the other organs, as you can see here, this is bladder, uterus, and this is the rectum part. They are sitting on the structure, which is right here. So I'm gonna take out these structures. I'm taking out the bladder. I took out the uterus in female and the rectum. Then you see this hollow part. That is what the pelvic floor is. This is what the pelvic floor is. And when you look at the bottom, this is what you see in the female pelvis. So this is what you see as a pelvic floor. And it is basically supports the bowel, bladder, and the reproductive organs. Along with that, we'll talk about their functions in a little bit. But this is what they are doing, supporting the bowel, bladder, and reproductive organs, in addition to maintaining the continency and elimination process. So how it is related, now why this pelvic floor is so important. Pelvic floor is the muscle which is part of the core muscle, basically. And when we talk about core muscles, like everybody, whenever they are doing exercises, whenever they are working out, they're talking about core muscles, or if somebody is having low back pain, they talk about core muscles. So what is core muscles? Core muscles are the muscles which are closer to your pelvis or spine. And those muscles basically helps to create the stability for the pelvis and the spine. Along with that, so these are the core muscles. So what all the core muscles are there? There are in our body, there are different core muscles. However, in the lower back, thoracic area, lower back, and the pelvic region, there are 4 core muscles that mainly I would consider. The front part is the transverse abdominis. This muscle is the deepest muscle in our body, in the abdominal area, and it goes from the spine all the way in the front. Then we have diaphragm on the top. So the diaphragm is sitting like this at exhalation, and on inhalation it drops down. So the diaphragm is one of the core muscle. Then on the back side, all these muscles that you see, they are very close to spine, is kind of multifidus, levator, multifidus, quadratus lumborum. So these are the muscles that is on the back, which are closer to spine, gives you stability, and the pelvic floor itself. So all this on the bottom, pelvic floor, on the front, the deepest transverse abdominis, on the top, diaphragm, and on the back, there is multifidus and quadratus lumborum and all the other small muscles. Creates the canister. If you want to imagine like a soda can, and then you put all these muscles, front, back, bottom, and top. That creates the core for the pelvis and the lumbar region. Now, why it is important, like why core muscles are so important, and why out of that the pelvic floor is also equally so important. So let's look at that. The core muscles needs to work before you even start the process of movement. They are called anticipatory muscles. And the reason it is anticipatory muscles is, like, for example, if you want to move your hand up this way, before you even initiate the shoulder movement, those core muscles needs to stabilize your spine in the pelvic region. It is like, imagine if you have to build a building, your base needs to be strong. If you're building top part, if the base is weak, and if you start building the top part, and like repetitively, if you have to strengthen out your base, it is not going to work out good. So there's something similar things in our body as well. Before you even initiate this, there is an activation happening at the core muscles. So they are called anticipatory muscles. Along with that, it is also important for the muscles to activate in a timely manner as well as an appropriate activation. So the timely manner, we discussed about it, like it needs to activate first. Along with that, in that core muscle itself, there are, depending upon the activities that we do, our body is set in such a way that like sometimes the pelvic floor needs to activate first before the transverse abdominis. So they have to be coordinated as well. And if you're pushing 20 pounds of weight and if you're pushing 100 pounds of weight, there's a huge difference. So you don't need the same amount of strength to push the 20 pound of weight, compared to 100 pounds. So the appropriate activation of the muscle is equally important. And why it is important? Because it is creating the pressure in this canister area. As you can see, this what we talked about, the abdominals, pelvic floor, back muscles, and the diaphragm is creating the canister. And these activation helps to manage the pressure. How, if you want to look at it, like what are the things that changes the pressure in this canister? So it could be breathing. Constant breathing changes the pressure. Coughing and sneezing, jumping, any activity, running, pushing, pulling, any postural task like sitting down, standing, laying down, squatting, or any limb movements, as we talked about, like jumping, running. So any movements will change this canister, the abdominal pressure. So think about it, like constant change happening in that area. To make it more like kind of visualize it, I've kept a balloon right here, okay? And what I've done is I've made the diaphragm, right? These two are the diaphragms on both the sides. These are the abdominal muscles. And the red part is the pelvic floor. And on the back, you have the back muscles closer to the spine. So these structures are very close to the spine and creating this canister, okay? Now, look at I'm gonna bring this back in a second, but what I want you to do is I want you to look at this video right here. What this skeleton is doing is when he's breathing in, there is an abdominal muscles expanding and the pelvic floor right here is dropping down. As he is exhaling, the pelvic floor comes up and the abdominals are going down. This is in a direct relation with your diaphragm. So as you breathe in, the diaphragm goes down, the pelvic floor drops down, creating more room for your abdominals. And this blinking red is the bladder, okay? And why it is? Well, think about it. This is your canister, okay? And if your pelvic floor or abdominals are not working properly, can create mismanagement in the pressure. So if you are breathing in with the tummy going in, what is happening? It's coming down from the top, the diaphragm is coming down, and it is coming in this way. Where do you think the pressure is gonna go? I think I need to go back. Okay, where do you think the pressure is gonna go? See, do you see the bulge? Right in this area? This is what is happening. So this is one example that I'm giving. So when the pressure is increasing in this canister, there has to be a way out. And the way out is going to be towards the weakest part of the muscles. If you are weak in this area, that is where the pressure is going to drop. If you are weak in this area, the pressure is going to go that direction. If you're weak in this area, the pressure is going to go in that direction. So wherever the weakness is, that's where the direction the pressure is going. And that is what we will be talking a little bit later, that how we want to manage it, okay? So when we talk about it, what all the functions of the pelvic floor are? We talked about the continence, desirable elimination at appropriate time, sexual pleasure, supporting of the pelvic organs, and pressure management. So all these things, it helps us to work appropriately. If the pelvic floor muscles are not functioning appropriately, it creates incontinence. It can create incomplete or difficulty in eliminating bowel or bladder. It can create pain with the sexual functions. It can create pelvic organ prolapse. It could be cystoscopy, like a bladder prolapse, uterine prolapse, vaginal prolapse, or the rectal prolapse, any of these things. And it creates mismatched pressure system, which can also lead to hernias. So this is what it kind of creates issues if we have dysfunction. Now, if you want to talk about what creates this all dysfunction, why do we not have normal functioning just like other muscles? So just like other muscles, some of the issues are very common, like muscle weakness, which could be not keeping the muscles activating appropriately with the desired amount, and not supporting enough. So it could be muscle weakness. It could be pregnancy and delivery process. So during the pregnancy, definitely you are carrying more weight. Women are carrying more weight in the pelvic region. So it's creating strain in the pelvic floor muscles. And the delivery process does not matter if it is vaginal or it is C-section. Any delivery process can create an issue for the pelvic floor dysfunction. And it is absolutely normal following the delivery to have dysfunction, but it is also normal for the women to get back on their routine as well. And many a times you will hear women having difficulty with that. Constipation, chronic constipation, where you excessively strain, sit in on a toilet for an extended period of time, creates this issue. Straining along with like a bearing down creates dysfunction of the pelvic floor. Overweight, again, the same, what we talked about. Chronic coughing, sneezing, asthma, or any respiratory related infections or disease can create dysfunction of the pelvic floor. And it's simply because you're constantly coughing. Think about this again. You're forcefully coughing, your diaphragm is pushed down, the abdominals are brought down in a very sudden and excessive force. So it's like this. So think about that, how like many a times you will hear women having they are able to control for 1 to 2 days of coughing, and then they're like, okay, I started having leakage. Or at the end of the day, they start having leakage, maybe just few drops, but they will have that. Or they will say like 1 or 2 times of coughing is okay, but if I cough for 2 to 3 times, 3 to 4 times repetitively, I will have the leakage. So that is absolutely possible with them. Muscle tightness. So the pelvic floor muscle also is just like any other muscles. They need to have good length and they need to have good tone. So if you are under stress, anxiety, you have a tendency to tighten up yourself, and it's very natural, right? When we are in stress, tensed, you will observe your breathing gets shallow, you will start breathing from the top muscles, you're like clenching. So all those relations goes in that area as well. So all the muscles, pelvic floor is after all muscles. So those muscles also gets tight. And if you cannot relax them enough in an appropriate manner, creates an issue. Increased muscle tone. So increased muscle tone can, which is a little bit different than the tightness. If you can think about it like a muscle spasm, that's where I would say that increased muscle tone. And for example, if you're stressed or, anxiety, and you are tightened up, and then you don't relax at all, then your muscles are shortened. Along with that, they have increased muscle tone. Trigger points, incoordination or incorrect habit. Incorrect habit could be not drinking enough water, going to the bathroom, even if you don't feel like going to the bathroom because you're scared of leaking and things like that, or sitting in an incorrect way, like sitting on your rolled down pelvis for an extended period of time. All those incorrect habits can create the pelvic floor dysfunction, or changes in the pelvic floor, which can happen throughout the lifespan. If you have endometriosis, it can create, like any medical issues, endometriosis, bladder, painful bladder syndrome. If you have chronic prostatitis in men, vaginitis, or UTI sometimes, those infections can make it difficult for the pelvic floor to get back on that routine and create the dysfunction and all the other issues. In women with menopause, creates the changes. Any kind of surgery in the lower abdominals, hip area, hernia repair, cancer treatment can create these issues. So any kind of cancer treatment related to the reproductive organs in men and women, bowel or bladder cancer, or breast cancer, also creates a lot of issues. Even the breast cancer, because the medications and the depletion in the hormones creates all the changes. So these are all wonderful reasons that can create our pelvic floor dysfunction. So if you have those dysfunction, what could be your sign and symptoms? So it could be persistent, ongoing pain in the lower back without your having any injury, okay? Or your MRI can be normal, or even many a times you feel like, okay, like I underwent the surgery and still I'm not improving. Possibility that the pelvic floor muscle itself is not responding, and it's continuously giving you the irritation and pain. Pain with the sexual intercourse, frequent sensation of needing to urinate, like repetitive urination, strong urge to urinate, pain during the urination or at the time of call, like a call for urination or the bowel. Frequent feeling of needing for the bowel movement or incomplete bowel movement, constipation, pain during bowel movement. Okay, that is done. Pubic symphysis dysfunction, which is the front part of these area. This bone right here, this is the front part, this pubic symphysis. This is kind of, it does have very minimal movement. This joint is like in millimeters, the movement. But that millimeter is also equally important, and many a times, like think about it, like see this, if you think about it, like this is the bone, look at all the muscles are coming right from the sides and coming right here, the same way inside, they are right in this area. So all these muscles are attached to the pubic region, and the pubic symphysis dysfunction can create a lot of issues. I think about one of the patient, and she came for physical therapy after 3 years of suffering for this pubic symphysis dysfunction. And all this, and she started with this issue after her hernia repair surgery. After following with lots and multiple images, multiple doctors, urologists, even the surgeon who did the repair, hernia repair, could not address the issues. And finally, she came for pelvic floor physical therapy. She was able to get back on her routine just in about 5 months, with about 7 to 8 sessions of physical therapy. She was able to go out for a long drive with her husband. She was able to do hiking. She was able to continue with no regressions and continually managed to perform all the activity that she was aiming for. And she was in her 60s. So absolutely. Incontinence with or without urges, postpartum recovery, or even the levator ani syndrome could be related to the dysfunction. So in other words, what all the conditions are treated with the pelvic floor physical therapy? Pelvic organ prolapse. Pelvic organ prolapse, I would say that, give me 1 second, sorry, I think I need to charge it. Okay. Pelvic organ prolapse are related to level 1 or 2, can be literally cured with pelvic floor physical therapy, and you can avoid the surgery. Or if you need to go for surgery, like if it is level 3 or 4, it is difficult to kind of get treatment with the pelvic floor physical therapy. However, if you have this, then what you can do is prevent it from happening again. You undergo the surgery. Before the surgery, you have a little bit of pelvic floor physical therapy. After the surgery, I would strongly recommend you to have therapy. And the reason is that there is more than 60% of chances that the first pelvic organ prolapse surgery that was done will fail in the next 5 years. And the reason is that the pressure management. If the individual is not understanding how to use the pressure appropriately, then it is difficult. I'm not saying that all the individual fits into that, but I'm saying like a research shows that more than 60% of the individual will fit into that category, and the surgery will fail. And believe it or not, those who undergoes the surgery at the earlier age, like MASH treatment and slings and things like that, they will end up having repetitive surgeries. So the pelvic floor physical therapy helps them really well. Stress incontinence. So laughing, sneezing, jumping, you leak few drops of urine, which is not normal, and the pelvic floor physical therapy can be helpful. Overactive bladder, that you have to go to the bathroom repetitively, or leakage. Anal incontinence, which is bowel incontinence, same. Vaginismus, which is like thinking of not just thinking, but it is an involuntary spasm of the vaginal muscles with any thought or any penetration of the vaginal area. And it creates an intense pain for those women, and they are not able to have any intercourse. So in vaginismus, pelvic floor physical therapy works wonders. Dyspareunia vulvodynia, which is also related to the pain during the intercourse, kind of any penetration in the vaginal area. Post prostatectomy for the male, when following the surgery of the prostate removal, they have to work on their pelvic floor. And pelvic floor physical therapy before the surgery and after the surgery is a great resource. I'm going to say one more thing. Like, I had one patient where one of the doctor is really good and sending all his patients, especially for post prostatectomy. And he came, he's like, I'm pretty good continent and I'm good. I don't think so I need physical therapy at all. However, kid you not, before leaving the therapy, he said, I'm glad my doctor sent me here, because I'm not going empty-handed at all. So the understanding of all the anatomy and functions helped him to improve his overall movements much better, and improve his activation of the pelvic floor as well. So he did not need it to continue with the therapy, so he was not picked up for therapy. However, that one session that he had was good enough, informative, and worth of his time. So I really like that. Chronic low back pain that we discussed, sacroiliac joint dysfunction. So again, I'm going to bring the model. This is the sacroiliac joint. This is the back part, and this is the ilium, the pelvic bone, attaching to the spine right here. So this part is right here. This part right here is your sacroiliac joint. And again, this does not have much movement, but if they do not function appropriately, you may end up having repetitive issues of your sacroiliac joint dysfunction. Many times you go to the chiropractor and they have to adjust to you. But along with that, you want to try and work on these muscles to function appropriately so that your sacroiliac joint does not get off from the basic position. So that is what you're aiming for. Sometimes it is difficult, but many times you are able to get cleared out with that. Pubic symphysis dysfunction, we discussed about it. Lower abdominal pain, scar tissues, any like endometriosis, lower abdominal pain with the menstruation, or constipation, or just change in your menstrual routine can create that issues, and pelvic floor physical therapy can be helpful. In endometriosis, it is not going to kind of cure the endometriosis. However, it makes it much easier and possible, one of the tools that women can have to control her pain. Postpartum changes. Those women who cannot recover naturally, this is the answer for it. I have gone to lots of gynecologists, urologists, urogynecologists, and the awareness is increasing. I would not deny that at all. It's really increasing, and I'm very thankful for that. But there are doctors, there are physicians that is still not on board with kind of requesting their patients for pelvic floor physical therapy, because they are not aware about what is new and how this can be helpful. And the pelvic floor physical therapy, which was 10 years ago, is not same today. So that is what it is. So postpartum changes. If you're not able to recover within 3 months, then I would strongly suggest. Second thing I would strongly suggest is like, you do have to give time. Like if you're breastfeeding, the changes will continue longer. However, you should be able to get back on your routine within 3 months. That is good enough time. And truly speaking, I would suggest that if you have never been to pelvic floor physical therapy, one time after your delivery, it is strongly beneficial. You can go after your 12 weeks or 8 weeks. Anything is okay. 8 to 12 weeks after that, you can definitely go for pelvic floor physical therapy. Does not matter C-section or vaginal delivery. Lower quadrant abdominal pain on the right or left side could be related with the hernias, or could be related with the muscular irritations, hip related. Any scarring in that area can also be treated. All right, so let's talk about the myths. Some of the conceptions that individuals have been having it for such a long time, which is not correct. First one is, it is normal to leak urine when you work out. I know there are 4 persons who are looking, but I'm sure one of you must have heard about that leaking urine during the workout is normal. No, it is not. Going to the bathroom before you need to go is a good idea. Not every time. Yes, if you're going for a long drive once in a year, and if you're going like that, it is okay. But each and every time before you go out for the grocery store, or like picking up your kids, or working out, and you feel like, okay, let me empty my bladder each and every time. No, that is not normal. Kegel are the answers. If I'm just doing Kegels, I will be fine. Or if I'm doing Kegels and I am not getting better, pelvic floor physical therapy is not helpful. No, that is not correct. Everyone that has incontinence needs to strengthen their pelvic floor. Well, that is not correct as well, because as we discussed about earlier, as you looked at the breathing, the pelvic floor was dropping down and up on each and every breath. So when you think about it, and when you understand that concept, that the muscle needs to lengthen out and contract to function appropriately, then you will understand that just the strengthening is not the answer for each and every problem related to the pelvic region. I'm too old for pelvic floor exercises. No, I have seen lots and lots and lots of women in her 60s and 70s, men with prostatectomy following that, men with like obesity and they have pelvic floor issues, men with the chronic prostatitis. So yes, all of this is possible. Oh yes, I love it. Men do not have pelvic floor muscles. No, they do. Just like females. It's a similar thing. Those muscles are absolutely same. Physical therapists do not perform internal examination or treatment. No, that is not true at all. Or the sexual intercourse is always painful. No, that is not true as well. So here, it's a little busy slide. However, what I'm going to show you guys is that this right here is a screening protocol. And if you mark 3 or more answers positive, it kind of shows you that you are more likely to have pelvic floor issues. And some of the things that I will read, which is like sometimes I have pelvic pain in just the genital area, perineal area, pubic bone in the front or the bladder area. And it is more than 3 from the scale 1 to 10, 1 being very like almost none to 10 being like extremely excruciating pain. You remember of having a fall on your bottom or your buttocks, lower back, tailbone area. Doesn't matter if it is in your childhood. I love this. Like this, even if you have this and this, one on each, I would suggest that it is a good idea to see a pelvic floor physical therapy. So I sometimes experience one or more of the following urinary symptoms, which is accidental loss of urine, incontinence, feeling unable to completely empty my bladder. You go for the bathroom and you have hesitancy, like you are not able to initiate the bathroom, and it takes few seconds before you initiate it. Or if you start going, it is kind of stops and go. So if that is happening, or pain or burning sensation during urination is the key. I often or occasionally have to get up to urinate 2 or more times at night. Another thing is like if that is happening after like about 70 to 80 years of age, I understand that, but otherwise no. I sometimes have feeling of increased pelvic pressure or a sensation of a pelvic organ slipping out. History of pain in the lower back, groin, tailbone area that we discussed about it, related with the bowel symptoms. So the symptoms related with the like loss of bowel, incontinence, feeling of unable to completely empty your bladder, bowel, like a constipation, or straining or pain with the bowel movement, or difficulty initiating the bowel movement itself can cause this. Can be included in this. I sometimes experience pain or discomfort with the sexual activity or intercourse. Sexual activity increases one or more of my other symptoms, or the prolonged sitting increases my symptoms as well. So sitting kind of in any position, kind of sitting in the hard chair generally brings up this issue, but sitting for a longer time is intolerated by these individuals. This is a very busy slide. If you guys need it, as this program is also recorded, and I can send anyone if they need it individually, I can send it to Anne and she can send it to you guys. So this is a cuisine screening protocol. All right, so few of the things that I would like to share with you today is keeping in mind about the breathing pattern. If you guys remember the video, let me show you guys the video. As you look at this video, see how the breathing in creates the expansion of this area, and as you breathe out, it creates the pelvic floor bringing, kind of pulling it up, and the abdominals kind of going in. And this is a normal breathing pattern, absolutely normal breathing pattern. So when we talk about it, one of the ways to manage the pressure in that canister is with the breathing. And when you are doing the strenuous activity, for example, if you are doing the squats, then when you're kind of squatting down is like going down and up. So going down is easier for you. However, coming up is a difficult part of the movement. So when you are coming up from the squat position, that is when you want to do is breathing out. So any strenuous activity, you want to do the breathing out movement, and do not hold your breath. Many times, like endless time, I have seen my patients saying like, oh no, I'm breathing. But the moment I say them like, okay, do it loudly, automatically the things changes a lot. So I would strongly suggest you guys, if you are doing this kind of squatting, and when you're coming up, you want to do, and then you come up. So while you're doing, you come up. So the strenuous activity needs to be done with the breathing out part. Or if you're doing constant activity, like not a one part you can say strenuous, but it's a constant, like pushing about 100 pounds of weight, for example, then you want to make sure that you're constantly breathing and not holding your breath. Now, do not take me on this. Like if you're pushing 500 pounds of weight, then make sure that you are stable enough the way you need to be. As we talked about it, like those muscles needs to activate in an appropriate manner. So you have to think about that. But if you are holding your breath, then you are going to create increased pressure in this canister, that what we talked about. This canister is going to have more pressure. And if you're doing it repetitively, it's not going to be good. So you have to kind of work on it. If you are feeling that you need to go to the bathroom right now, like the moment you think about going to the bathroom and you have to go, the urge is very difficult for you to control, then what you need to do is try to first do is breathing. I'm not kidding you. The breathing will help. Distraction. Distract yourself. Try to do quick flicks. So what do you mean by, what I mean by quick flicks? So contract your pelvic floor and let it go. Contract and let it go, and do it very quickly. Do not keep holding your pelvic floor. Just contract, relax, contract, relax. Do that for about 5 to 10 times, and you will be able to dissipate your urge. Make sure that you are drinking enough water. Do not make your bladder very irritated with the concentrated urine just to avoid the urge. That itself can create the bladder to contract, that overactive bladder. And if the bladder is contracting, it is going to create the leakage. So keep your bladder happy. Sitting on the toilet with the knees higher than the hip height. So if you have constipation, if you feel like you're not able to urinate appropriately, many times with the pelvic organ, like a uterine prolapse or the bladder prolapse, cystosia, can create difficulty eliminating the bladder, like a urine. And sitting on a toilet with the kind of knees higher than your hip height, I would say, if you have heard about Squatty Potty, I'm not propagating that, but it's a really, really great product. If you do not want to go for that, that's absolutely fine. Just put a stool right under your toilet and bring your both the knees up. I would strongly suggest, personally, I do not like people sitting with their toes down and heels up to bring their knees up. No, relax yourself, bring your both the knees apart and kind of sit with both the elbows or hands on your knee. So your back should be kind of a straight, and it should not be like a slouch. And then try to go for your bowel movement. If you have constipation, it will really help you. When you're doing the Kegel, make sure you're using the entire pelvic floor muscles, all the way from the back, all the way from the tailbone to the front. So you should be able to feel the rectal area as well as the front of the vaginal or in men penis area pulled up towards the abdominal region when you're performing with your when you're performing the Kegel. This is important because many a times you will kind of see that individual is missing out. So make sure you are working on the entire area. Another way to think about doing that is make it kind of zipping up. So zip up from the back to all the way in the front when you're doing the Kegel. Avoid bladder irritating food and drinks if your bladder is not very happy. If you have constant urges or frequent urinations and things like that, or if you leak with the urges, then avoid kind of eating citrus food, spicy food. So citrus food will be tomatoes, oranges, grapes, spicy foods, literally chilies. You want to avoid eating them. Drinks. There are so many, and I know some people might not like it, but caffeine. Coffee is one of the major, caffeine is one of the major things. Chocolates, cheese, alcohol, all the acidic, carbonated drinks, you should avoid it. One other thing that works really well, if you cannot avoid coffee, try to drink 1 glass of water before you drink your coffee and 1 glass after you drink your coffee. So the intention is that you are diluting the concentration of the caffeine, which will help to reduce the irritation of the bladder, and it will help you. So try to avoid those foods and drinks if you have severe urgencies. To improve the hesitancy or incomplete emptying, perform breathing on toilet. So for example, if you are going on a toilet and it takes a longer time to initiate, simple, best part that what you want to do is do nice deep breathing. And believe it or not, it will help you a lot to completely empty your bladder, and it will help you to initiate the flow. And do this deep breathing, okay? I'm going to ask you guys to do the deep breathing right now, and we're just going to do for about 5 breaths. I'm not expecting that you will end up having, you tell me that, okay, I was able to feel it. If you are not, that is absolutely normal. Because the movement of the pelvic floor that you saw on the video is very, very subtle when we are doing them. And you really have to get connected to your pelvic floor to be able to appreciate that. To do that, what I want you to do is you can either laying down with your both the knees kind of bent is a better position. If you want to keep it in sitting, I'm absolutely fine with it. Put your one hand on your chest and one hand on your tummy, okay? And then when you're breathing in, what you want to do is you want to focus on breathing in, expanding your tummy out. And as you breathe out, you're going to bring your tummy in. The chest hand that you have kept it is going to be more relaxed. Okay, so the intention of doing the 360-degree expansion of your chest is important. Okay, however, I like to get started with the abdominal expansion first, taking one piece at a time. Get the abdominal expansion, get into that habit, and then try to incorporate your chest being expanding in front, sideways, and in the back when you're breathing in. Okay, so let's just do 5 breaths and see if you can send your breath all the way down to your pelvic floor. So taking nice deep breath. If you want to close your eyes, go for that. That is the best way to focus. Breathing in nice. When you're ready, let the tummy go out. Let the air go all the way down to your sit bones. And when you're ready to exhale, just relax. Inhaling again. When you're ready, let that deep breath go all the way down to your tummy, going further down to your hip bones. And when you're ready to exhale, just relax and exhale completely. Inhaling again, deep, letting the lungs expand, letting the tummy go out. Let that air go down towards your pelvic floor. And as you're ready to exhale, just relax. Let that exhalation be passive. Inhaling again. Let that deep air go all the way down, expanding all the energy going down towards your pelvic and vaginal area. And as you're ready to exhale, let that air go all the way out. Exhale completely. One last breath of deep inhalation when you're ready. Let it go all the way down towards your hip. Let that energy go further down to your knees. And as you're ready to exhale, just relax again. All right, gonna slowly open your eyes, you can. So why it is important? The deep breathing helps you to kind of connect and appreciate your pelvic floor. And once you're able to connect and appreciate, you will be able to understand the pelvic floor issues much better. At last, I would strongly suggest you guys that ask for help. And the reason that I brought up the history in the beginning was that many physicians are still not very aware that what the pelvic floor physical therapy can do. Many a times I have seen, like I would give you my own personal example. One of my best friend, she was pregnant with intense tight pelvic floor, and she was almost 38 weeks pregnant. She would have pain when her physician would do pelvic floor examination for her, and she would have intense pain. She would have difficulty, like it was super tight. And when I suggested her for a pelvic floor physical therapy, the doctor was not like, oh, it's not going to be helpful. I did telehealth with her. I helped her to relax. Her physician continued praising, like, okay, whatever you're doing, it's doing great. You're much better. In just about two sessions, she was able to kind of tolerate the pelvic examination by her physician. And by the time she was ready for the delivery, she was much, much better. However, it was not, I would say, in terms of a physical therapy. It was my yoga knowledge that I shared with her, because I was not having a script from her physician, and in Texas we need to have a script. So I could not treat her. So I was just able to share my yoga-based pelvic health with her, and that made so much difference. So ask for help if you feel like you need it. Your health is in your hand. Kegel is not the only way to handle the issues of weakness, prolapse, or hernias. You definitely need to kind of get the assessment, identify the issues, perform the physical assessment by the therapist, and you need to have a kind of a customized treatment plan. It may not need a lot of treatments, just may need about 2 to 4 or maybe just 1, and you're able to understand it much better. So I would strongly suggest that you go for therapy if you need. And thank you so much. I would end it and stop sharing. You guys can ask me if you have any questions. Okay.
Okay, guys, if you have questions for Kathy, you should be able to unmute yourself. And you can ask them at this time. You can also type them into the chat. And she can get your questions answered at this time.
I do see there is a question about what about stopping urine midstream? It is absolutely no. And the reason it is no is because when you are stopping urine in the midstream, what is happening is that your bladder gets a message that you are done urinating. So the bladder is not contracting anymore for complete elimination. And you are left with more amount of urine in the bladder. So if you're doing it to check whether you're able to kind of work on your pelvic floor good or not, then maybe one time is good enough to understand that. And you don't have to do it repetitively again and again, or each time, or to see whether you're working correctly. No, you should never have the habit. You want to urinate, let it complete, let it eliminate completely, and then later on, you want to try performing it without urination. Does Medicare cover PT for pelvic floor? Yes, absolutely. The pelvic floor physical therapy is just like a regular physical therapy, and it is absolutely covered by Medicare. Are you considering interstitial cystitis as painful bladder syndrome? Will slides be provided after the class? So yes, considering interstitial cystitis as a painful bladder syndrome. And the reason I kind of named it under the painful bladder syndrome is because it is a kind of a recent way of saying it. Because when they mention that interstitial cystitis, the inner lining of the bladder that gets inflamed and irritated, which maximum studies that they have also found that many times, individuals, I would say, have those inflammations, but they do not have any symptoms of interstitial cystitis. So now they have changed the name of interstitial cystitis under the painful bladder syndrome. And in fact, the pelvic floor physical therapy is a type A treatment, like a first line of treatment for this issue. So I'm not saying that if you have this issue, then all the other things does not need to be done, or the medication does not need to be given. However, the first thing that they need to do is to kind of tie up with the pelvic floor physical therapist. And your second question was, will slides be provided after the class? Yes, it will be provided.
Yes, I'm going to email the slideshow out to everybody who registered for the class tonight.
Okay. And I will email you in just about a few minutes about this PowerPoint. How do you ask doctor to prescribe PT? That's a very good question. So I would say that you you talk to them about what are your issues and what you have heard, or kind of, I can provide a lot of research articles that can support how the therapy can be helpful. However, for those research articles, I need to know what the other issues are. Another thing that you can try to do is you can pull up pelvic floor physical therapy online, and there are lots and lots of things that is available online as well. The third thing that I would say that you as a patient would like to try doing therapy. And as I said, like if you are not required for the pelvic floor physical therapy, I don't think so any therapist would keep you like, okay, no, we can do this, no, we can do that. No, if you don't need it, you don't need it. However, if you need the further knowledge of understanding, for example, the pressure system, then yes, it is required, and it is education for yourself that you can ask for. So maybe just ask for one session that you prefer to have it. It is nothing harm in it, and you want to try for it. And that is what you can ask for your therapist, physician. How do we contact you for PT after we get the script? So definitely, I can provide you my contact information. I do telehealth at this point. Online, you might see that I have a place. However, I'm closing that place because I'm going to be moving out of state by end of December. So no matter what, I can get you in touch with the other therapists who are doing the pelvic floor physical therapy. And I know some great physical therapists that I can kind of get you in touch with, or I can get you a telehealth as well. The number will be and do you want me to kind of send you my card?
Sure, I can include that as well.
Okay, so I'll send you my card. That way you can contact me. Put a link to the recording when I send out the slides. Okay, sounds good. All right. Any other questions? All right. Thank you so much, guys. I hope that it was worth our time. If you have any other questions later on, I do not mind answering it at any given time. Just give me about 24 to 48 hours and I will reach out to you for sure. You will not be hanging. Thank you.
Thank you, Kathy. It was very informational. I appreciate it.
Thank you. Thank you, Anne. And just hang in there for maybe about 15 minutes and I'll get you the presentation.
Okay. Thank you.
Thank you.
Thanks everybody for coming.
Thank you, everyone.